All right. Hello, C11. My name is Joseph Allen, and I'm one of your instructors here at the PIMA PTA program. I think at the time I'm recording this, I don't know what day of the week you're going to be watching this, so you may or may have not already met me in another class, but I'm just going to assume that you haven't met me yet. So, um, I've been a physical therapist for about 15 years and teach a little bit of everything, teach a lot in the beginning and then a lot at the end. And then I'm little bit of jack of all trades in the middle of the program. So you'll see me throughout the whole program. This class is medical terminology. So this is going to be one of your first semester classes. This class is going to be totally online. So we will never actually do this class live. This is my only class that is like this, so don't get used to this. But this is a very basic class and it's a very vocabulary focused class. So we felt as a faculty, this would be a good class to give you as an online class that you could do on your own and refer to the recordings and the PowerPoints, which I'm going to let you have. So we'll get started now. So I'm going to share my screen with you and we're going to get started on today's first lesson, which is just introduction to medical terminology. Let's make this bigger. Okay. So one more slide. Medical terminology that we have today. Most of the words that make up the medical terminology, the medical field, medical words, names of diseases, names of procedures are based on Greek and Latin words. We have that in place because so we can keep things very similar throughout the world, because you don't want to have medical records, people moving from country to country, taking their medical history with them. And if things are written in just completely different languages and not even from the same root words, at least, then doctors are going to have to rely on complete translators just to know what their medical history is. But if a lot of medical terms are written in Latin and Greek origins, and so it is it's easily interpreted across languages and across cultures. So if a person moves from the USA to, let's say, India, well, no, they speak English there too. So let's say China. Well, they may see some of the words that we have in our procedures and diseases, and that particular healthcare worker may not understand English in our medical records, but they may see some of the familiar words that that are similar to the same words they use too, because globally we use these words. Okay. Now whoops. So I already went ahead a little bit, but let's say the medical term osteoarthritis. Well, that term means inflammation of the bone and joint, but there are 6 English language words that have that exact same meaning. So the medical term for arthritis of the bone and joint is osteoarthritis. That is the actual diagnosis and the diagnosis that would be used worldwide. But the other 5 terms in the English language that use inflammation of the bone and joint are not used in medical language because they would just confuse other people. And using the same term just improves accuracy of the healthcare record and of the healthcare system and of procedures that healthcare providers can provide. Okay. So objectives of today, what you get out of lesson 1, besides listening to my wonderful presentation that I'm giving you and full of wonderful information, and I know I'm so entertaining, But I do want you to take advantage of the online resources that you have for your textbook. So on the front cover of your textbook, you do have a code that each of you has, and scratch that code off and go to the publisher's website that's on the inside cover of your text, and it gives you all the access to the student resources. There's videos, there's lots of puzzle type games to help you with remembering these things. I highly, you might think that seems kind of silly, but I highly recommend you taking advantage of those things to help you remember things. Just for trying to memorize words and meanings off a list is not going to be a way to remember it from my test. You're going to have to be able to read clues on a puzzle and then know the word that it's asking you for. So I highly recommend taking advantage of that. And I will tell you, students from the past that have used those resources have tended to do better in this class. You can read. I am going through these objectives pretty fast. I'm not going to read them all, but you do have access to this PowerPoint and Blackboard, so you can read them on your own. Okay. Now, I just got through telling you that there were terms well, let's back up. Some terms are built from word parts. So maybe instead of a whole word in Greek or Latin, it'll be part of a word. So let's take the word arthritis. Well, the root word arthur means joint, as in any joint in your body: elbow, knee, cervical joints, vertebral joints, any vertebral joint, your elbow joint, your jaw even. Those are joints, things that bony prominences that move together. Say they have a hinge or a ball and socket. You know what a joint is. Arthur means joint. Well, okay, so we know Arthur means joint, but let's go back. The rest of the word arthritis, where does that itis come from? Well, you'll learn later on that itis stands for inflammation in either Greek or Latin. I don't know which language, don't ask me which, but it's one of those, trust me. But when you put them together, arthur means joint, itis means inflammation. So together, arthritis means inflammation of the joint. So that's how root parts of words are put together to make new words. Okay, now there's some names, some words in medical language that you've probably already just been thinking about that are not built from word parts, such as names of individuals. These are known as eponyms, such as Parkinson's disease is an example. So the way Parkinson's disease got its name, it was the doctor that discovered Parkinson's disease and its pathophysiology and how it works. His last name was Parkinson, so he named it after himself. So that word Parkinson's disease is used in other countries and across the world, but it's just not Greek or Latin. So there are exceptions to my rule. Sometimes you can have acronyms that are not built from Greek or Latin, where they're from the first, maybe a very long scientific name, and we take the first letters of each of those words. So take the example of MRSA, stands for, many of you may pronounce this MRSA. This is an infection that's usually called in hospitals. It stands for methicillin-resistant Staphylococcus aureus. It's an antibiotic-resistant bacterial infection. You don't want to waste your time, 15 seconds, saying methicillin-resistant Staphylococcus aureus all day. So now we just say MRSA. Everybody knows what it means. It's quicker to say, easier to say. We get on with our day. Okay. Other things not built from Greek and medical language would be modern and technological language, like MRI machines. MRI stands for magnetic resonance imaging, where you go into the tube or the tunnel, and the strong magnet spins around you and takes images instantly. And we just named that for the machine. It's not named after any Greek or Latin word. Okay, we already talked about word parts and with the example of arthritis. So a word root is gonna, if arthritis means joint inflammation, well then arthur of the arthur section of arthritis is going to be the word root. That's the core of the word, the fundamental meaning. So most medical terms have one or more word roots, but they're all going to have at least one, because you've got to have at least one word root to know what you're talking about. Sometimes I'm going to say word root, and when I was in English class, we said root words, so you may hear me say those interchangeably. Just ignore me. They mean the same thing. Okay, so let's take this word, oncologist. Well, the term onc, O-N-C, means cancer or tumor. Okay, most of you probably already guessed that. Pretty common word. So that's the core meaning of this word. So we know, we can look at this word, and even if you didn't know what the last part of the word means, the ologist, you know this word has something to do with cancer. Well, then we've got to look at the suffix attached to the word root. So in this case, logist or ologist or ology or ology is always going to be somebody that studies that, or somebody, or the study of that. So in this case, it's attached to onc. So oncologist actually literally transfer tumor study. So this, or a tumor specialist. So this means a doctor that specializes in cancer. So if you have cancer, you go see an oncologist. Let's try that again. Okay, sometimes you'll get a prefix attached to the word root. Okay, so meta usually means spread. Stasis, well, we'll get there in a minute. That's the word root. Sometimes, oh, and this is just going back. Sometimes they put in an extra O or A, a combining vowel, just to make the word make grammatical sense and to make it sound right. Let's go back to the suffix, sorry, prefix. Meta means spread. Stasis means actual, think of like the state of something, or if something is in balance or something is in flux, that would be the state or the stasis of something. So meta means spread. So if we say metastasis, or the way we pronounce it is metastasis, that means spreading of something into the balance of the body. So in our language, we use metastasis in referral to cancer. And so when we say that tumor has metastasized, or it's metastasizing, that means it's spreading from one place in the body to another place in the body. You never want that. Okay, like I said, sometimes they put a combining vowel in just to make it sound right. Okay. Here's let's tear apart a word all on one slide. Intravenous. Well, the word root is ven, which means vein. Okay. The prefix is intra, which means within. So you can probably look at intra, the word in means in, so it's inside of the vein. So we know intravenous means something to do with the inside of the vein. Us means pertaining to. So in this word, it's literally translates as within the vein pertaining to. So put that together in a way we can understand, pertaining to within a vein. So intravenous means talking about inside of the vein. So if you're talking about an intravenous IV line, it means a needle or a line, external line going inside of the vein. Okay, let's do that again with osteoarthritis. Our word root is oste, which means bone. Okay, but look at this. We have another word root, arthur, which means joint. So now we've got two word roots. Uh-oh. Don't let that scare you. Now let's just think about what we've got so far. We've got bone and we've got joint. So we know this word has something to do with bone and joint. Okay. The suffix itis means inflammation. Okay. So put it all together. Osteoarthritis means inflammation of the bone and joint, which is the most common type of arthritis. Okay, let's speed through these real quick. You're going to learn all this in anatomy and physiology from Ms. King, so I'm just going to fly through it since it's not really part of medical terminology. Cells are the basic building blocks of living things. They make up they come together and make up tissues, and tissues are groups of cells that perform a specific function, like muscle tissue. And then an organ is two or more kinds of tissue that come together to perform a special body function. So muscle tissue will come together and form an actual muscle belly, like it will form one of the heads of your bicep. So that's actually an organ. And then the system, group of organs that work together to perform complex bodily functions. That would be your muscular system or your musculoskeletal system. But again, you're going to go through it like this in a lot more depth than A&P. Muscle tissue is made of muscle cells. Nerve tissue is made of nerve cells. Same with connective tissue. Epithelial tissue is a type of connective tissue that covers membranes and lines cavities and organs. Okay. Again, you're going to go through this anatomy and physiology, but let's just we'll talk about this real quick. We have three cavities in the body: the cranial, the spinal, and the thoracic. The cranial cavity is, of course, as you guessed it, inside your skull, and that holds the brain. The spinal cavity is the cavity that goes down our vertebral column and holds our spinal cord. Very important. And the thoracic cavity is our whole thorax and most of our lower abdomen, which holds all of our main important organs in our body, almost all of them. Take them all away, and then there's just a big cavity, a big hole. Then we have the abdominal cavity, which has mostly some of your digestive tract, some of your urinary tract, and then our pelvic cavity, which is like our pelvic floor, like at the bottom of our pelvis. You think of the pelvis as actually a bowl, and the pelvis is the bottom of that bowl, and that holds the bladder, a lot of the reproductive organs, some of the small and large intestines, and the rectum. It's just a short, simple picture of the body cavities. These are some body systems. I'm going to let you read through these on your own in the PowerPoint and Blackboard. But you are going to go through these in ad nauseam in other classes. Okay, so let's review. Word roots are the core of a medical word. So carcin. Also, if you think of carcinoma or carcinogen, that also means cancer. So I told you earlier, you're thinking, wait a minute, Mr. Allen, you said ONC, onc meant cancer or tumor. Well, so does carcin. So sometimes two things can mean the same thing. Yikes, got to pay attention. Cyte, CYT, means cell, always. Epithelial always means epithelium, which is the covering of organs or tissues. Hist is tissue. Think of lipids, liposuction, that means fat. I probably don't have to explain that one much more. My means muscle. So think of well, you don't know what a myotome is yet. Just think my means muscle. My muscles. Show my muscles. Ner means nerve or nervous system or nervous. Onc, there it is again. It means tumor or cancer. Path, that means disease. Think of pathology. Plasm, that means growth. Not like an old plasma TV, which is out of date. This means a plasm, which means growth in the body. Sarc means flesh or connective tissue. Like a sarcomere is a connective tissue in your muscles. Stasis means control, stop, or like I said earlier, it means balance or control, or the state of something. Viscer means, like, think of visceral, internal organs, like your stomach and your GI organs. Okay, suffixes are at the end of words, like al, genic, logist. So al just means pertaining to. Genic usually means I've lost the word in my mouth. Genic usually means creating or making something anew. Logist is the study of, or I'm sorry, logist is a person that studies a disease or bodily function. Log is the study of that bodily part or function. So you can say oncologist is a doctor that studies tumor, and oncology is the act of studying tumors. Oid is just means pertaining to. Oma can mean an opening. And then these are just connecting vowels. Prefixes, we went through meta before, can mean a spread. Neo means new. So if I say neoplasm, so we had plasm in the last slide, plasm means growth, so a neoplasm is a new growth. And usually that's not something supposed to be there. You go get it taken care of. We've already went through combining vowels, and these usually don't even change the meaning of the word. It just makes it easier to pronounce. So let's think of some words. Producing cancer. Okay, so we heard carcin and onc. And then for producing, we had genic. Genic meant producing or creating anew. So we could say producing cancer, we could say oncogenic, or carcinogenic. And the proper word is not oncogenic. It means the same thing, but you would be wrong. The proper term is carcinogenic. So we probably all heard since we were kids that cigarettes and nicotine contain carcinogenic chemicals. They produce cancer in the lungs. Tumor of connective tissue. That would be onc or it just left me. Sometimes Mr. Allen has brain farts. Onc or carcin, and of connective tissue, which is, what was connective tissue? Sarco. So it would be sarcoma. So instead of carcinoma or oncology or something, they used oma, which meant tumor. That's a new one. See, up here they said producing. See, sometimes they give us the answers back in the wrong order. I don't know why. Tumor composed of nerve tissue. That would be a neuroma. Word root and suffix. Resembling a cell. Cytoid. Cyte means cell. Oid means pertaining to or resembling. That's just a little diagram of metastasis, cancer spreading. Okay, let's look at some words here. Carcinogenic, cancer causing. Carcin means cancer, genic means producing or creating. Carcinoma, cancer of connective tissue, oma. Cytogenic. Cyto means cell, genic also means creating. So something is creating a cell, cytogenic, creating new cells. Cytoid means resembling a cell or pertaining to a cell. Cytology, cell, it means cell, study of, or the study of cells. Epithelial is just epithelial, can't really change anything about that word, and that's just the lining or covering of organs and connective tissues. We'll have a few more. Epithelioma would be a tumor of the epithelium. Histology, hist means tissue, ology means study of, so this is study of tissue. Metastasis, we've already talked about that, that means spread. Myoma would be a muscle tumor. Neoplasm, I've already said that, new growth. Neuroma, nerve tumor, we've had that one. Sarcoma, connective tissue tumor, we've had that one. Lipid, pertaining to lipids or resembling lipids. Lipoma, an actual fatty tumor. There actually are fatty tumors. That's really common in dogs, actually. Neopathy or neopathy means new disease. Pathy means disease. Oncologist, we've had this one about 5 times already, I feel. Means a person that studies cancer. Study of cancer. Pathogenic, that means producing a disease or something that produces a disease. Patho means disease, genic means creating. Pathologist, a person that studies diseases. Path means disease, ologist is a person who studies. Study of diseases. Visceral just means visceral organs. Okay, almost done, people. What is a diagnosis? That is a word that means that is your actual disease or what the doctor tells you that you have. Prognosis is your health outlook. So when they tell you, when they tell you it'll take about 2 weeks for you to be fully healed and better over this, from this flu or from pneumonia, or if they say, or if you've sprained your ankle and the doctor, and you go and you've torn some ligaments and they say you're going to be in PT for about 4 to 6 weeks, and then you should be pretty much back to normal. That's your prognosis. Prognosis for a sprained ankle, if the doctor tells you 4 to 6 weeks, that's your prognosis until you're healed. Prognosis for if I have a headache and I take 2 Advil, my prognosis is probably going to be about an hour or 2 before I feel better. All the way around the world, just to define that word. Benign, that means not dangerous. So you probably can think benign cancer, benign tumor is a tumor that is not dangerous to the body. You're not going to die from that tumor. They always remove it, but it's not a dangerous tumor. A malignant tumor is a dangerous type of cancer. So this is the type of cancer that does grow and spread and does cause organs to fail and people to have to take chemo and go through all radiation, and then may ultimately die if they don't defeat the cancer. Inflammation is just extra blood flow to the area. Edema, which is swelling. Other cytokines, which are just information and enzymes that the cell releases into the body to bring into the area to fight whatever's happening. That all causes you to swell, and redness, and that's what we call inflammation. Remission refers to cancer when something is gone. There's no trace of it. Chemotherapy is chemical therapy during cancer. Radiation therapy is radiation therapy during cancer. So this is the abbreviation, and we're always going to end each session with abbreviations. So DX is your abbreviation for diagnosis. PX is your abbreviation for prognosis. Chemo will always mean chemotherapy. CA will always mean cancer. METS always means metastasis. XRT always means radiation therapy. Don't get that don't let that X make you think it means X-ray. XRT means radiation therapy. And here we go. Here is a note. So let's just look through a few things here. And let's just skim this note. Let's not read it word for word. But let's start skimming it. We see our patient and her age, 3-week history of bloody diarrhea. Sounds nasty. That's her symptoms. She had been diagnosed. So her diagnosis is ulcerative colitis. And she has a 3-week history of diarrhea. So she has 2 diagnoses: ulcerative colitis and bloody diarrhea. Okay. The examination revealed a lesion in her colon. So they performed a cytology specimen, which is basically like getting a small tissue sample of the cells of the lesion. Pathologist, the person that studies diseases, looked at those cells and made a diagnosis of carcinoma. So a tumor in the colon. Okay. Then they found inflammation in the colon. The patient underwent surgery and then was found to have no metastasis, no spread of the cancer. They did remove her colon because of the risk of developing another malignant or dangerous tumor. She was referred to another oncologist, continued chemo, and then they're not going to give her radiation. So now let's go back through the words one last time. Your diagnosis would be abbreviated DX. Metastasis would be METS. Chemotherapy would be chemo. Prognosis would be PX. And radiation therapy would be XRT. Well, that's the end of our lesson. So I hope it wasn't too boring for you. Hopefully we're going to speed through these a little bit quicker in the next lessons. And they'll go a little bit quicker, and you'll get more out of every lesson. But of course, the first lesson is more of an introduction and just teaching you a little bit how words are built and what to expect. So there will be a homework assignment attached to this, and that will be available on Blackboard on the first day of class. So remember that there are 2 lessons per day. So there will be 2 recordings. So don't forget to, after you get done watching this recording, there's a second recording that you can watch at your convenience. Okay, guys, thanks a lot.